Question. Alexis, where are you? I lost you again. Please.
Hi. I've been trying to speak on this the whole meeting. Thank you for coming here to this town hall meeting. My name is Pam Gentry. I wanted to talk about the misinformation that appears to be out there, especially in the media and the internet, about the current proposal for public health care option. And I was hoping that you could explain your understanding of this provision in the current draft bill 3200. And I would like you, if you could, to address the following 5 myths that have been spread through the radical, some of the radical talk show hosts and through the media. One of those, I have the floor right now. I did not interrupt others when they were speaking. One of the myths is if you could address whether or not House Bill 3200 includes a death panel that would decide whether seniors get to live or die.
Stop.
Would you address?
I'm not taking notes here. I'm the staff here, but let me just on that one.
Okay.
I've had some of my family at Mayo. I won't go into this dissertation about it, but I respect that pretty much. It's quite a place. I think all of us probably know it's a okay place. People come from all over the world there. And they have done studies. They're constantly doing studies and say that at the end of life, that it's very expensive. Nobody likes to talk about it, you know, but it's very expensive. And they have discovered through counseling and so on that they can cut that almost in half. So the process, the cost. Let's be respectful here, just for a minute. We're talking about something that's very serious in our lives and with our loved ones and at some point with us. So the point is, if an individual, is what I see in 3200, I looked at it very carefully, the draft, but if an individual wants to plan that part of their life, they've got a diagnosis that's, it's terminal, or they just want to be in charge themselves rather than somebody else deciding for them. If they choose, and this is key, if they choose, they can go to their doctor and get counseling, and if the doctor participates in that, he gets paid for it. It's like an office call. Now, they can make it, this person can make a plan, or they not make a plan. If they make a plan, they walk out the next day or the next hour, they change their mind, they can do away with the plan. It's all voluntary, simple as that. And I don't think that's bad.
No. So basically you're saying that it allows the individual senior citizen more control over what happens at the end of life. It's just a living will.
Yes, it does that, and it goes a little further, because as Mayo has discovered, if the people sit down and talk to their physician one-on-one as a choice, that they'll make good decisions and they'll get better care and it will cost less.
Yeah. So instead of the health insurance company deciding what happens, the private citizen.
Well, there's that side of it, and there's just probably all of us know families and individuals where somebody gets incapacitated because of illness and so on. And then they have to make these very, very tough decisions. It happened to me. I had a very serious surgery. I don't know if you ever noticed, I was a little ill here a couple of years ago. And my wife and daughters were told into a lengthy surgery that the doctor had to make a decision. He'd come out to them to make it. You know what? They've had a conversation with me. They said, "Dad, you make those decisions. We don't want to make them for you."
Right.
I got to think about, I kind of like to make those decisions too. So this will allow that opportunity, but it's by choice. It's voluntary.
So there's no death panel.
No.
Okay. The second one is: does the draft HB 3200 will it result in rationed health care?
I don't see how. I don't see that at all.
Page 78 and 85 of the bill specifically say that.
It says rations?
Yes. Yes, it sets the maximum benefit levels for people under the public option
plan. You bring that to us, we'll discuss it with you. Go ahead.
The third was, will this bill outlaw private insurance and force citizens into a public plan?
No, I do not think so.
Yes, it does.
Will this plan cut senior citizens' Medicare?
No, I do not believe so.
Will this plan bankrupt America?
I actually think it will, if we can construct this as a way that a lot of us hope to, with PAYGO and so on, and I actually think within the system, without even going outside the system, there's the opportunity to pay for this thing and actually save money. There's a number of features in there. The clock is running. There's another number of features in there that ought to save a lot of money. And if we can do that better, you know, this fee-for-choice thing that's going on, for example, on the Medicare reimbursement, they get so much more money. I thought they said down in McAllen it was because a lot of folks go down there to snowboard and so on, and I got bored down into it. That's not the case at all. That's not it. Most of the folks go down and they've got insurance, and that's not the point. But anyway, the fee-for-service, if they just keep inefficiently and keep adding things for you to check and do, it runs the price up. Miami has a lot of that's going on. So I think there's a number of features in here that will put some restraints on that, but still read the opportunity to get your health care. And so I think it actually will save money. I think that's a possibility if we can come up with a very good bill, which I'm a farmer. I got eternal hope. I think we can do it. I want to try.